Rebecca Trimber. Hello, everyone. I am going to talk to you today about cardiac tamponade syndrome. So, cardiac tamponade is basically when the sac, the pericardium around the heart, fills with much more fluid or blood than is normal for that area. And what it does is basically it compresses the heart down so that those chambers can't properly fill with enough blood, and then it isn't perfusing the body or the brain correctly. Somebody who has cardiac tamponade syndrome can manifest with several different kinds of symptoms. A lot of times they will go with chest pain, shortness of breath, tachycardia, because the heart is trying to compensate for that low blood volume. It's going faster so it can go ahead and keep up with the demands of the rest of the body. They can have dizziness, palpitations, extremity swelling, which can be caused by the backup of that right atrium into the rest of the body. And they can have right upper abdominal pain as well, which can be referred pain from that chest. Now, the complications from this syndrome can be very serious. You can have heart failure, you can have pulmonary edema, you can have bleeding internally, you can go into shock and even death eventually if this is not treated. So it's a very serious syndrome that does require medical intervention when it does happen. There are several diseases that are associated with cardiac tamponade. Mostly we see cardiac tamponade happen a lot with trauma to the chest or the abdomen, in car wrecks or even in sports. But there are several diseases associated with it that can cause it, like hypothyroid disease, which is when the thyroid is not producing or releasing enough thyroid hormone into the body. And this can lead to the metabolism really slowing down in the body and lead to pulmonary edema and this heart issue as well, the cardiac tamponade syndrome. It can also be caused by a myocardial infarction, which is an MI, which commonly we know as a heart attack, right? So basically, the heart muscles in an MI start to die and aren't pumping efficiently, and that can cause fluid to build up around the heart and lead into cardiac tamponade syndrome. Rheumatoid arthritis can also cause this. This is an autoimmune disease that causes swelling in the joints, but can also cause issues around the hearts and the lungs of people. So this is why it leads into cardiac tamponade. Now, the big things are differentials, right? So when a doctor is looking for cardiac tamponade syndrome, they're going to have to rule out a lot of other issues with that person before they can get there. So a big one is heart failure. Heart failure can have some of the same symptoms that we see with cardiac tamponade. It can have chest pain, it can have shortness of breath, it can even have swelling in the extremities. But some of the big ones that we want to look at, the differences between these two are abdominal swelling is not common in heart failure. In heart failure, you can have an irregular heart rate, which isn't normal in a cardiac tamponade. You can even have some wheezing that are audible in the lungs, which is not normal for cardiac tamponade as well. And then you can also have a cough with heart failure, which is basically caused by the backup into the lungs from that heart, and you can bring up some pink just frothy sputum with all of that. So that's going to be a big help to differentiating between these two diseases and symptoms. Another one that they'll have to rule out is pericardial syndrome or peritonitis. That is an infection around the heart. So some of the same symptoms that you can see are extremity swelling. You can see tachycardia, heart palpitations, and even shortness of breath. But some of the big ones that are different is pericardial syndrome can have a cough, a fever, and some major abdominal swelling, not just up in the right upper quadrant. And also another part that we're going to look at before we diagnose cardiac tamponade is cardiogenic shock syndrome, which can mimic it, right? So some of the same ones are tachycardia, hypotension, which was a big one with cardiac tamponade, and some shortness of breath. That's going to be very early on, and then hypotension is going to come into play a little bit later. But some big differences is that when we get into shock, even cardiogenic shock, is that we are going to start to see extreme altered mental status. We are going to see extreme hypotension. We are going to see that they are pale, they are cool, they are diaphoretic, so they're like sweating buckets, right? And then we are going to see still some of that fast breathing, and then a very weak pulse once we get far into shock. One of the big things that they use to differentiate cardiac tamponade syndrome from some of the other cardiac symptoms that we can see is called the Beck's triad. So the Beck's triad is a big old triangle. At the top of it is hypotension. One of the bottoms is muffled heart sounds, and the other one is JVD, which is the jugular vein distension. And those are the three big things that they really start looking at when they look at cardiac tamponade syndrome.